I want you to be I want you to be able to use this time for me to help answer any questions. I will frame it though, just to tell you kind of about my journey of how I went through it many years ago, and also I've mentored quite a bit of undergraduates and medical students, residents, fellows across the whole spectrum, and they've all been exceptionally successful. So I feel free, you can interrupt me at any point, or you can save it for the end. But where I'll start is kind of how my journey started. So I actually, when I finished high school, um, I was interested in the sciences for sure, but I quite hadn't made up my mind. Actually, I remember applying as a bioengineer, and I wanted to go to the best school for bioengineering. I ended up going to UCSD, and when I got to UCSD, which is again very similar to how UCSB is, uh, I quickly realized that as fun as engineering was and as fun as the sciences were, I kind of had a maybe a potential interest in medicine. So I again was pre med, whatever that meant at that time, and I ended up actually double majoring. I ended up switching my major to biochemistry, cell bio, and I also had a double major in history. I was just very interested. I had done well in the AP courses, so I was able to complete both degrees in 4 years. And I hadn't quite made up my mind if I wanted to do medicine or not. So I said, and I had a very good job opportunity at the time. So I worked actually as a bioengineer because my minor was in bioengineering for a large pharmaceutical company. I made very good money for someone out of college. But as soon as I started working there, I quickly realized that maybe there was something really big missing, which was patient interaction. And when I was an undergrad, I volunteered a lot. I shadowed an immense amount when I was at UCSD. And probably the best times were when I was in clinic with some of the doctors and residents. So that really prompted me to, and I'd already had thought about medical school. So I had applied, I did well on the MCAT, and I said, you know what, I'm going to just go ahead, I'm going to apply. So I applied, and I was very fortunate enough at that time to get into three schools. All three were on the East Coast, though. And, as I'm sure many of you know, when you're Armenian, your family wants you to be close to home. But the first point and advice I'll give you guys is I think things have also probably changed in the community is it's very competitive these days for medical school in general, more competitive than when I was applying. And I think you always have to aim for the best school you can get into, whether it's within California or outside of California, and you go without question, okay? Because later on, you'll come to see that it actually pays dividends. It helps open up doors. The key with every aspect of medicine is to do something that's going to keep the doors open, not close them. So then I ended up going to VCU in Virginia. I had a scholarship there, and I did very well during medical school. And then in medical school, I realized that my interests in working in oncology, which was in the field that I did my bioengineering in, really prospered. I ended up even coming during medical school here to Cedars when I was a medical student, and I did research. I published even then. And afterwards, I applied for residency, and I got my top choice. And then I did residency here at Cedars. I continued to do active research. And then at that point, I really knew I wanted to be an oncologist. So then I did a chief year here in medicine. And afterwards, I applied again broadly to the top oncology fellowship programs nationally. And I got my number one choice, which is at Johns Hopkins. I finished my fellowship there, and they recruited me, the faculty here at Cedars, where I hold academic appointment here. I also hold academic appointment at UCLA and still at Hopkins. And that really generally kind of summarizes my path. The only other two things I want to mention is that, one of the critical things that probably all of you are facing now is the MCAT. I wonder how many have taken it or are going to take it. Does anyone know, Hosmik or Hi, can you tell me how you guys are doing that now, or who's in that place where they're going to take the MCAT soon? Okay, so I see Sophia took it.
Sophia's taken it. Yeah, I remember when she was studying for it. She can, if she wants to talk about it.
Yeah, but maybe let's hear what Sophia has to say. Actually, I'm curious to see her experience if she wishes to share it and what she learned from it and what her study pattern was. And I'll tell you how I studied.
Oh, sorry, I'm like in the middle of moving. All
No, it's
right.
okay.
Yeah, so I took it back in March.
Okay.
Um, it was very challenging, I'm gonna be very honest. I mean,
Yeah.
I went to UCLA, I did very well academically there, but this was like a new breed of
Yeah.
something. Um, but I learned a lot on the way as to what I did wrong and what I should have done. And so now when other people ask me how they should study, my advice is just do practice questions. That's like
Yeah.
make it or break it. Sitting
Yeah.
down and reading the book 5 times,
Yeah.
making flashcards, wasting your time writing notes that you're never going to look at again
Yeah.
isn't going to
Yeah.
solve the problem. Just do
Absolutely.
practice questions.
Absolutely. And let me ask you something. There are two kinds of people when they study for the MCAT. There are the people that study over a year, and there are those people that do what I call a kind of a short time frame, high yield study, like 6 to 8 weeks. Where were you in that?
I tried to keep it within like 2.5 months.
You
So
did,
I
yeah,
didn't want to spend the whole year. So I just wanted to get it one and done just
yeah,
because I've noticed that like when you're trying to like extend it a little bit, you're like, oh, like
yeah,
I'll just do it tomorrow, or like you have a practice test. No, I'll just do it next week.
yeah.
So that kind of just delays things a lot. And a year is a long time. In a year, you can get a lot of things done.
Absolutely. And I think that's an important point. So the way I did it and the way I advise all my students to do it is you are better off if you can dedicate a summer for that matter, or a very concrete period of time, 2 to 3 months, and all you do is study rather than space it out over a year. Now, there are some people that can't do that, but I would tell you in my experience and the students I've mentored, the most successful ones that have, they've scored in the 95, 98 percentile of the MCAT, they really just essentially hunkered down and they studied for 2 to 3 months straight. And their study, actually, the way I did it was I would actually study about 12 hours a day, between 10 to 12 hours. And questions are a key thing. I would do essentially in blocks of 4 hour block, take an hour break, 4 hour block. And then at the end of every night, I would do 3 hours of questions. That's actually where really the value of your studying comes up. And as you go through it, there's actually a point in the 2 to 3 months where you peak. Ideally, by the time you're getting close to taking the exam, you will have peaked in your practice exam scores, and then you take the MCAT. And everyone that's gone through here with me, even at Cedars or when I was at Hopkins, they've been very successful in that regard. So that's a very important point, and thank you for sharing that. And I see other people kind of echo what you had said. I know it sounds like other people have also taken it and followed what you've done. So that's one very important thing. The second important thing is everyone who's probably in this room right now and the people who are your classmates, you are all very smart and hardworking individuals, or else you wouldn't be here at 6 o'clock listening to this. So that just points out that it's very competitive. So oftentimes you have people that have high GPAs, great MCAT scores. So how do you differentiate these people? And this is where I sit on the admissions committee. I did it at Hopkins. I do it here at UCLA too, for the School of Medicine. And at the end of the day, sometimes it's us like picking apart almost like very small details. And it's really in things like research and what you're doing above and beyond. Like if you could, for example, publish, not necessarily as a first author, but be involved in research that's peer reviewed and published in your undergrad years, you will set yourself apart from a large majority of applicants. Now, just as again, similarly, who has gone down this path? What's been your experience or challenges of either publishing or getting involved in research?
I'm currently in like a more behavioral neuroscience research. Like I'm a RA.
Yeah.
And we did have like a few. I did run some subjects for a
Yeah.
while, for about a year, and then for that task specific, like for what that study was, they did publish a paper. And like the doctor at that time, he was like, "Oh, whatever, whoever helped, whatever RAs helped, they can put their names in there." So, as much as I know, I think I am in there somewhere, but it's
Well,
still,
you could go to PubMed, and if it's in
yeah,
PubMed, then you're there.
yeah.
Have you looked?
No, I haven't
You
actually.
should look. We can
Or
look
maybe
today.
they haven't like finalized
Probably.
it because
Yeah.
the process is so long, like to publish a paper. Like you have to go through so many things. Like at that time, like they were talking about it. Even today, we had a meeting, and just to like get a grant is like such a big deal. It's so much work. So
Yeah. So in my lab, we publish extensively, but yeah, you're absolutely right. To actually go from a productive research project to publication can take often years.
yeah, it
And it
takes.
also matters where you publish. So every journal has what's called an impact factor. So you could publish anywhere, but you want to publish in impact factors of 3 or higher typically. And the ideal is to publish in impact factors of 10. And then if you can publish in 20, you're like a world-renowned scientist. But the point for you guys at this stage is really just to be involved in research that you can eloquently speak about. Because when you guys go to apply an interview, they're going to ask you, I ask all the people I interview, so tell me about your research project. And I can already in 1 minute know who just put their name on something or who actually was involved and did work because they can speak comfortably about it. And that's the kind of thing you want to get involved with, whether it's at at UCSB, UCLA, or elsewhere for that matter. And there are ways to do this. I've talked to Heike even about this before, where I don't know if you guys have the ability to use credit and work in a lab and get actual credit. That's a great opportunity. I know the UCLA has that for sure because I've had many UCLA undergrads come and work with me and I actually grade them. So the point is that you want to use every opportunity you have, especially in the first, second, third year of undergrad, to get productive research done over a long period of time that leads to some form of a publication. That's very, very important. So, if you can take care of the MCAT, you can take care of research. That only leaves one other real aspect is what is your exposure to clinical medicine? So tell me, like, what have you all done in terms of your exposure, or what are you going to do for getting, shadowing, etc.?
I'm very Heike.
Hi, go ahead. You're muted.
Oh, yeah. So one thing that I did last summer was I went to Armenia with a pretty big group of people from my high school, and we basically did an internship at the Pediatric Cancer and Blood Center in Yerevan. And basically, I feel like that kind of got my foot into the door, and kind of primed me in a way to go into some research because of the lab experience that I got from there. And then also like in high school and currently I'm doing like some shadowing with some surgeons and stuff like that. So I feel like that would be my thing.
So that's fantastic. You have had a wide breadth of it. So, it's good to do it in kind of two ways, right? You had one very concentrated experience where you went to Armenia, you did that. And when you guys do the AMCAS, the way the AMCAS is, I'm sure some of you may have already applied. You have to put like each kind of project or thing that you're doing, and that will serve as one of them. And then you have more of what's called longitudinal shadowing, which is probably even better because at the end of the day, your letters of rec should come from people that know you well. And it'd be great for someone who maybe in the clinical space has spent 2 years seeing you grow and learn and everything that you're doing that could speak to your research and can speak to how compassionate you are, how much you're interested in medicine. That's why it's important to have kind of a wide breadth of experience, but you need to do this. Like if you apply and you haven't had clinical exposure, your application will not go through. This is without question. So that's another really important part of it. The grades go without saying. I mean, most of the time, everything is weighted. So your GPA gets a weight, your research gets a weight, MCAT, etc. Everything has a weight to it. Of course, the MCAT and your GPA probably carry the heaviest weight, and then everything else comes as a second. Okay. Now, what I want to do now is maybe hear about some of the challenges you guys may be having now. What are the big challenges that, as undergrads, you're experiencing in your path to applying to medical school? Or anyone that's applied, where are they in their application?
If I can share. So I'm currently in the cycle now.
Great.
And in my situation, like I've heard back from schools, but I haven't heard back from like half of the schools I've applied to, and we're already in like the end of January. So I'm
Yeah.
kind of like, I feel like I'm not gonna hear back at all from those like half of schools that I haven't heard from. So I don't know, I kind of wanted to know what your perspective is on that.
Yeah, it's a good question. I will tell you though. So if you haven't heard at all, as time goes on, especially as you head into spring, the chance of them saying something is probably lower. But don't count it out. Especially towards April, May. Actually, before even April, there's a lot of movement. People are waitlisted. People say they're not going to go; they go somewhere else. So things can change. You can be offered a last minute interview, or if you've interviewed and you're waitlisted, you can shift from the wait list into a program. For one of the schools I applied to, actually, I think it was May, I heard that I got from the wait list into the school. So I got into NYMC, and it was in May they told me this, but I already had committed that I was going to go to VCU. But so this happens. My last student who got in last year, he heard about his interview, the interview for the school he ended up going to in February. So it's not over. This still continues on. So don't count it out. Just wait. And especially, let's say there's a school that you really are enthusiastic about and that realistically you're competitive for, and you have a good mentor or contact, they should try to reach out for your behalf if you can do that. Like, for example, for my students, what I typically like to do is, if I know that they're competitive and we have connections at these institutions, we'll reach out and say, this is a great candidate. I know them, and at least vouch for them. And sometimes that can simply open up the door for an interview. Or if you've interviewed and you're waiting to hear back, that can open up the door for them to really look at your application closely. And if you've interviewed there and you're still waiting to hear back from them, it's absolutely okay to send a letter of kind of intent as an update that, hey, you know what, I'm very interested. This is a top choice of mine. And since I sent my secondary in, I've done X, Y, and Z, and I'm even a better candidate. You should feel free to do that. That actually does help. So these are things to think about, and it's not over. It's not over yet, but just keep waiting.
Thank you.
Of course.
I think for me, I'm mostly a little bit nervous about GPA and how competitive I can be, especially after the year of OChem that I took.
Yeah.
So I was just wondering, I don't know, what's like the ideal like threshold, like at what GPA do you think is like realistic to apply, and whether it's worth taking maybe like a year off to do a post-bac or take some extra classes?
Yeah, no, this is a great question, actually. So there's two parts to this. First of all, you have to also ask the question of, are you applying to allopathic or osteopathic, right? So generally, most people I encounter, and my recommendation is it's not that one is any less or more than the other, but generally the more competitive programs and the ones that keep the most doors open are the allopathic MD programs. And my advice always is, if you are competitive enough, you should always go for the MD allopathic programs. If you're not, an option, if you have a lower GPA, typically less than 3.5 or 3.4, without question, you're still very competitive for osteopathic programs. If you're 3.5, the only way to really still be competitive is you have to have an MCAT in the, we're talking 95 percentile. So the MCAT has to offset where your GPA is. If they are both equal or one is even lower, then we can look at this as an individual basis. Sometimes people do want to take that extra year of doing either a post-bac or dedicated research, something to set yourself apart, because now you're going to be in a pool of people that already have, fairly competitive MCAT scores and GPAs, right? the 90th percentile of the MCAT is 515. If you're above 515 and your GPA is 35, you can do it still. But you need to have something to set you apart. I'll give you an example. I have a student right now. In fact, I'm going to have him maybe speak to you guys. He's even closer to this now. His name is Arsen. Arsen he's a stellar student. His GPA was around 3.536. His MCAT was 519. That's a very high MCAT. Okay. He didn't get in. He had all this other stuff too, but he did a little shadowing. He did all that, but his research was kind of low level and nothing to talk about really. Okay. He maybe was on one thing and he didn't do anything extensive. So he worked with me. And in 1 year, he did high level research. He published in 4 different papers. He got to speak at a national conference and nothing else changed. Same application, same MCAT, same GPA, same everything. He has 3 offers, one essentially almost 80% scholarship. So what I'm trying to say is that if something is missing, you have to make it up somewhere else. So if your GPA is not quite there, try to focus on the MCAT. Blow the MCAT out of the water, apply that same year. If you can, take the year off. Okay?
Thank you.
But typically 3.5 it's kind of at least for the mid-tier to high-tier schools.
Yeah.
There are some lower-tier schools where you can probably get by between 3.3, 3.4, but it's still competitive, especially for allopathic programs and especially today because, you know, it's just very, very competitive. The pool of applicants is extended, but the slots haven't increased that much.
Yeah, that's
They've
the
increased
thing.
very little, if any.
Yeah, I'm exactly at 3.5, and the issue is that I've taken so many classes already that even getting straight A's now, it raises my GPA so little.
Yeah.
So it's very difficult and it's very stressful.
But don't worry. Look, but I'll tell you this. For example, if you can show, and I pay attention to this, and the committee pays attention to this. So you have your lower level and higher level graduate undergrad courses. If in your first 2 years grades are mediocre or average, but in your last 2 years your upper divisions you're knocking it out of the park, getting A's, that carries weight, and especially if you show that. You know what? Yeah, it was a little bit hard to transition, but now not only did I do great, but my MCAT is above the 90th percentile, then you're doing great. Okay. And if you look at, average matriculants, the applicant's average is around 3.6 with the MCAT of 90. The matriculants average total GPA is around, you're probably looking at 3.7, 3.8, right? So it's an average bell curve. Some people less, some people more. But even if you went to the 90th percentile, you're still going to be around 3.4, 3.5. So that's kind of a hard cutoff, I'd say. Okay. Or is anyone considering doing a year more or taking time off? Is that something that people are considering doing? Yeah, so I'll tell you guys something about a year off. It's okay to do it actually. The ideal is if you don't do it because you just go right through it. But sometimes you have to. I took a year off. I wasn't sure what I was doing. But you have to use the year wisely. If you take a year off and you don't do anything meaningful, that shows in your application. If you take a year off and you don't score very well on the MCAT, that's a minus. Actually, you get minus factor. But if you use the year off to show that you're doing high-level research or you're working in a science field, you're doing something productive, then that shows that you really are serious about medicine. You want to go in. This is really what it's all about. All right. Now, let me open the floor for any questions about anything. It doesn't have to be medical school. It could be about medicine. It could be about the practice of medicine. Things that you guys really want to know.
Right.
Anything. Please feel comfortable to ask.
You kept mentioning your students. I wanted to know, like, what kind of program is it that you offer? Like, what do you what do you do like with your students?
Yeah, no, it's a great question. So my job here, I work as a physician scientist. So I have a very unique clinic. I spend about a day and a half in my clinic. I'm a pancreas cancer specialist. So I'm very, very heavy into research. So I'm funded by the NIH and by the NCI, by ASCO, and I have a lab. And I also run clinical trials. So there's the clinical aspect and there's the basic science research aspect. And every year, I have 1 to 2 students that come and work as research assistants with me. And it's not easy. It's actually, they get paid, but it's a very hard job because I'm very clear with everyone where they come in, they work, but the job is meant for people who are interested in applying to medical school and they want to become even more competitive. Because you're going to do your normal 9-to-5 job, but for your career and to advance research, we work after. We work on weekends. And people in my lab, they do lab work. So we for example, we collect tissue specimens from the patients on my clinical trials, and they do in-depth immunologic analysis. So we have a technique I developed called multiplex IHC, that the slides get the IHC, and then we use computer-aided software to take and quantify protein and cell types, and then we analyze this in high detail using bioinformatics. So my research assistants and students help with projects related to that. And I have at any given time about 5 to 10 projects in the pancreatic cancer space, looking at immunotherapy, responses, etc. So they work on any aspect of that. Some of the folks that are more interested on the clinical side, they come in and they help consent patients to biobanking, help consent patients to clinical trials. They work with me to enroll patients on clinical trials, monitor these patients. We have projects where we have large databases we've built over years, where the students go into they update the databases, then they pull data, and then we have a simple scientific question that's important and clinically relevant that they help answer. And all the work that they do, we publish. So there are many projects that they're involved with, but this is just a flavor. It's either on the clinical side, on the basic science translational, or on database research. And they get to do any one of those. So that's what the students do. Okay. Vaughan, I think, has a question. Go ahead.
Hi, thank you for
go after. Go ahead.
Yeah, thank you for taking the time to be here. I'm just curious to know how your journey has been. I believe do you have a PhD or are you just an MD?
No, I'm one of the I'm a MD. I actually, and it's a great question. I chose not to do it, but my fellowship was longer than most people's because I ended up doing a sub fellowship, and I spent 2 years in the lab. So I'm one of the few probably MDs that has a PhD type background. That's why I have a lab. But yeah, you can do that too.
I was just curious to know how your journey has been, like, because I'm sure it makes it much harder to get NIH funding and have your own lab when you're just an MD as opposed to having that MD PhD to your name.
Absolutely.
So how has that journey been?
Yeah, no, this is a great question. So I'll tell you this: if you actually are interested in doing being a physician scientist, and you like being in the lab, you probably, and if you're willing to give up the time, because there's a time commitment to it, you should do an MD PhD for a few reasons. Number one, you have a full scholarship. Your medical school is paid for. It extends your medical school by about 3 years. You don't graduate with your friends, but you end up graduating in a very competitive space, but you have to commit to that path, okay? And that's the one upside and downside. Now, in my case, I was very fortunate enough, and my residency, I did very well. I was a chief, so I took another extra year. And so I kind of did a PhD in an indirect way, but I did it more on the clinical translational side. So during my chief year in medicine, I did an immense amount of research. I published 3 first author papers in high journals. And then when I applied to fellowship, I got into the best possible oncology fellowship, which is at Johns Hopkins. Johns Hopkins is considered the top tier oncology. It's generally one of the best medicine programs in the world, but in oncology, it's at the top. And when I got to Hopkins, I did very well. to the point where I went in, as a fellow, I got grant funding as a fellow. I paid for my own salary. And that allowed me to work in the lab. And I took an additional year and I worked in the lab to acquire a skill set. So if you can acquire the skills, you're knowledgeable, and you can apply for grants, you essentially do everything a MD PhD does, but you have to show it. So that's the one kind of downside where, yeah, as you said, you don't have that background with it. So you have to go out of your way to acquire that during fellowship. But if you know for sure you want to go down the path of a physician scientist, in my opinion, you're better off doing it in medical school. You have more leeway. If you're not sure, it's okay. Then don't do it. Do it later on, as long as you compete and go to very good fellowships like, Dana-Farber, which is Harvard, Sloan Kettering, NYU. These are big institutions that have very competitive fellowships. So it's a good question. For me, again, I ended up in the same place, and I probably at this point do better than most MD PhDs. I have the funding that I have. Most MD PhDs, it even takes them 4 or 5 years. I got it year one of starting my faculty position. But you have to be committed. That's the key. You have to really put time and effort into it.
Thank you. And I have another follow-up
Sure.
question going off that. So you're a GI oncologist.
Yeah.
And that's like a very niche type of field. Like,
Yeah.
when did you figure out you wanted to go into oncology? And was it like in undergrad, medical school, residency?
Residence.
And then why GI specifically?
Yeah, this is a great question. So, and this actually brings up something I wanted to mention to everyone. The key to your success, besides your own aptitude and your work ethic, is mentorship. 100%. You have to find an excellent mentor, one that you feel comfortable with, but one that's also very hard and pushes you to be better. And to answer your question, I knew I was interested in oncology even in medical school. I actually knew that after doing medical school, doing research in medical school. When I started my residency here at Cedars, and I left after residency, but even here in my first year, I had 2 mentors. One was a GI medical oncologist, and the other one was a GI radiation oncologist. And as a result of that, I kind of got into it. And the GI cancers are, especially pancreas cancer, and of all cancers, it's the hardest tumor to treat. Psychologically, physiologically, biologically, in every way, it's a big challenge. For me, that was a huge drawing point, that I wanted to be in medicine in a place where the challenge is so large and there's so much room for improvement that, when you're in medicine, you want to help people. And these are the people that really need the most help. So that's one of the big reasons I did it. And the key to my success, and why I knew as even a year 1 resident, I'm going to do GI cancer. And I kept doing research, and I got deeper and I got more interested. Then I knew I wanted to go to a fellowship that was the best GI oncology fellowship. So I have a sub-fellowship in pancreas oncology. It's very niche, but I knew it. And I knew it because I had such great mentors. And interestingly enough, even though I went to the East Coast, I finished my fellowship, my mentors were the ones that recruited me back. I never applied for a job. So most people that go into medicine apply for a job. But if you do things right, you work hard enough, the best case is when you are at such a level where they actually call you and say, hey, we want to give you this job. What can we give you to get this job? Well, you actually are offered a position. You should work towards that, because that puts you in a position where you can leverage so much in terms of your career, in terms of salary, in terms of quality of life, and career development. And the key, I cannot belabor this point, find a good mentor. It's key. It's key. I've had mentors that are not only my friends today, but they are instrumental even till today. Like even though I'm almost a 4th year faculty here doing exceptionally well, every week I meet with my mentor. My main mentor is still at Johns Hopkins. I meet with him for 1 hour a week, and he still grills me till today. He still pushes me till today. He's at the top of the game. I mean, he's a professor, full professor. He's a co-director of a cancer center. He's funded 10 times more than I am. I mean, but the point is that you still need mentorship no matter where you are in your career. It will help you. And don't ever forget that. Okay.
Thank you.
Yeah. Sophia, go ahead. I know you also had a question.
Yeah, thank you for sharing that. I just wanted to kind of pick your brains a little bit. As someone that's previously been on the David Geffen School of Medicine admissions committee, I just kind of want to know what your thought process was as you would go through an application.
Yeah. So UCLA and many of very good academic programs have an initial filter. So if you got to pass that filter, the first filter, and that's how the secondaries go out too. So after the first filter, there, as I told you, there's a weight that's applied to everyone's. So there, and then they lump people based on the categorical weight that they're in. At least for me, when I look at it, there are two things that really matter. Yeah, we know where everyone stands in terms of GPA MCAT. That's fine. That part is pretty objective. We don't really get too much into that, although it carries an immense amount of weight. But if we have people within that same kind of grouping, their MCATs and GPAs are relative to each other, you have to stand out. It's really what makes you stand out. So research is one big thing because research is not easy. Mentally, it's not easy. Also, it's a commitment that most undergrads won't do. They have other things they want to focus on. And what are you doing that's above and beyond what normal people would do? And in fact, we actually like it when someone does things even outside of medicine and they still show that they're interested in medicine. We like it when, for example, you have done something that's not just very short, but you've shown that maybe for 2 years, you've committed to doing volunteering work. I'm going to use an example. You went to a shelter, but you did this literally for 2 years. We actually personally, I give more weight to someone that does 1 to 2 things consistently than someone who did 10 things for 2 weeks. That's like you're just trying to buff up your CV and your MCAS. So we can see through that. The other part is, even though everyone, you all write the essays for for admissions, we read that. We do read the essay, and you can always tell when someone just writes a generic essay and who's versus someone who's being sincere and actually shows that they're really interested in medicine. That comes out. So every part of your application matters, but you should really focus on, even when you write the application or you go to your interview, that you talk about the things that set you apart that's not in the application. You have to always bring that up in some way. And you should know your application. Like if you did an activity and someone asks you about it and you give a generic answer, you get a minus actually. We give a minus for that. Or same thing with research. If you wrote that you're a second, third, fourth, fifth author on some manuscript, and I ask you about that research and you don't know, you get a minus. Actually, the fact you're on a paper actually hurts you because it's not real. And we can see that. And Geffen, UCSD, top schools, UCSF, Hopkins, oh man, they're sticklers about this stuff. So you got to be thoughtful about your applications. I always tell, when you do it, have someone else review your application. Very important.
Now, can I ask a follow-up
Sure.
question? So, okay, so I'm just going to kind of talk about my case.
Yeah.
So like, let's say I hit all of those things that you're referring to,
Yeah.
being in a research lab for 3 years, having
Yeah.
a publication, presentation,
Yeah.
lots of extracurriculars, leadership, but it's still like, haven't heard back yet, like, or let's say it gets denied. Like, what kind of goes wrong in that situation?
So let me ask you, you mean you haven't heard at all or you haven't heard after an interview? Because
So I haven't heard at all. Like from UCLA, for example, I haven't heard anything at all.
Yeah. So I'll tell you one other thing. When you guys are all in state, okay?
Mhm.
It's very hard. And there's a somewhat of a business aspect to it too, to be quite honest with all of you. Because when you're in state, you pay less tuition. When you're out of state, you pay more tuition. And the applicant pool for in-states is more competitive because there are more in-state people coming in. So don't be discouraged by the fact you don't get UCLA. Okay, I was 94th percentile, 95th percentile for my MCAT out of stellar. UCLA didn't even offer me an interview. It was unbelievable. And then I got interviews on the East Coast and multiple interviews and 3 admissions and scholarship. But again, don't worry about that. Now, if you don't hear anything at all from any of the schools, there are 2 things I would ask you. And I've seen this happen actually. One of my mentees 2 years ago had this problem. He's like, "Well, I didn't get in." It's like, "Well, how many schools did you apply to?" He's like, "Well, I only applied to 20 schools." I'm like, "Which 20?" And he applied to the top 20 schools in the country.
Yeah.
Okay, I'm like, there's no way. You're like, you have to, your application for anyone, even if you're a stellar candidate, has to be split into 3 tiers. You have about 10, 15 dream schools, like these are your top echelon. The largest bulk is the middle tier where you, based on your MCAT and your GPA, you compete well for. You should have about 20 in there. And then there's the lower tier, like backup schools. And you should have about 10 to 15 there. And that way it's evenly distributed. Now, if you've done that and you still haven't heard, then we really got to look at your application with the microscope. I don't know.
No, I'm okay on that. And I was
Yeah.
just kind of curious about
Yeah.
UCLA and like what's going on there. But what you're saying makes a lot of sense.
The only time I have ever seen that a person gets some love from UCLA has been in two circumstances. Number one, they did undergrad there. Every undergrad gets an automatic interview, more or less. Not everyone, but I'll tell you, majority of them get it. Even ones with like low MCATs, low GPA. So that's the one advantage of being at UCLA. If you're there, it helps a little bit, but it's not guaranteed. And the only other time is if you're like a really stellar candidate. I mean, you have to be. That's the only thing. But honestly, don't mind that. That doesn't mean anything. Honestly, UCLA is great, but it's they're better schools.
Okay, thank you.
Yeah. Vaughan, go ahead.
Oh, I just wanted to talk about this because I'm currently MS1 at UCLA right now.
Good for you.
And I think in terms of like MCAT, GPA, or at least from what I've seen, so like my class, there's a lot of diversity in terms of like
Absolutely.
Not just like demographics, but scores and GPAs and everything. Like there's people that are sub 500 MCATs all the way up to like I've heard of 520s.
Yeah,
but
absolutely.
I think one thing that's more important than scores and GPAs is really like how you convey your stories. And most people generally have like a theme or something that really got them into medicine, and they were able to really talk about that theme through their activities. So I would look into like shaping the section on the MCAS that's like the most meaningful experience, making sure those are like top, and then your personal statement as well. Because then after that, like it really just takes one interview. Like if you get the interview and you just knock it out of the park, you have a good personality and everything, then they're gonna want to advocate for you and want you to get in. But I think before the interview and everything, your entire application is in writing, so you really have to make it stand out. But there's also that the luck aspect of it too. Like it really just comes down to who reads your application, whether or not they like it or not. So
absolutely,
luck plays a big role.
Absolutely, and that's why I said don't mind if you don't hear it, and everything. It really even at UCLA, it's a bell curve. That's why you have people who come in with below what the 90th percentile is. You have the higher people, as you had mentioned. But to that point, we read everything in that application. That actually makes a huge difference. Huge difference. And the interview, if you get it, is actually what determines probably at that point if you're going to get in or not. Because you already are in that competitive pool. And when the admissions committee meets, your surrogate voice is the person that interviewed you. So how well you can convey who you are, why you're there, your research, etc. It says everything. You have to really show that you want to be in medicine, especially for the competitive school. But again, don't let. I'll tell you, as I said, there are some kind of not hard cutoffs, but there are some general rubrics we follow. But if you are stellar in other regards and your application conveys that, you can still apply and still successfully get into the medical school. And you see, this is a good example. You have a resource here for the rest of you, who's someone who's an MS1, right? You should always look towards people and establishing that relationship of what worked for you if you went to this school, and try to learn from that. It's a huge, it's an invaluable asset. And I'm glad he shared his numbers. See, that's fantastic. And even he will probably be able to even help you even more because he's more contemporary in terms of going through this site.
Okay, can I ask another question?
Sure.
I kind of wanted to know how you were able to successfully get through like 4 years of medical school. Like what were the main resources you used, or like what kind of helped you stay on track?
Yeah, so for me, and this is different for everybody. I was very focused. Like, I went to school on the East Coast, and and you have to know what your study habits are, like what works for you. I'm not a flashcard person. I don't do that. I wasn't a lecture person either, to be quite honest with you. I didn't like going to lecture, and I didn't feel it helped me a lot. But I was a person that was very good at sitting down in a very confined space and just reading and learning and reading and learning, and that worked for me. And I found that instead of using the notes or going to class and doing all this extra stuff, probably didn't help, or doing these studies didn't help me. I was more focused on the syllabus and just working out that way. So that's one thing that you need to recognize first, identify what works for you, and then just stick to that. And don't, if someone tells you, no, this is what works, there really isn't an answer for that. Just you know yourself, you know your study pattern. Just don't, the key is not to waste time. The second thing is, similarly, when I was taking step 1 and step 2, I'm a firm believer in focused studying. I'm not one that studies over a long period of time. You sit down, you hunker down, you get it done. And that worked for me on step 1, it worked for me on step 2, and etc. So those were the other parts of it. As you go into your 3rd and 4th year, when your clerkships begin, that's a little bit of a different beast altogether. The key to that is really, your aptitude. You have to know that you have to stay up to date because you take your shelf exams for each clerkship. But the key is that you have to have impeccable work ethic. Medical students are all, by and large, just by their nature, hardworking. But you have to set yourself apart because, like, for example, when I went to school, even in our surgery rotations or medicine rotations, we're in groups, right? You have to be the first one there, the last one out. You have to know your patients. Like, always strive to do that. And the other thing that I did that at least helped me a lot is I was still active in research during medical school. It's not easy. I'm not saying you should do it, but it helped me even in the one summer that I had off, that I was not studying for step 1. I actually used that summer to my advantage. It helped me for residency. So what I did was, I kind of knew I wanted to come back to LA for family reasons. And I found a research position. I came here to Cedars. I worked very good for 3 months. I actually published in those 3 months. And then that helped me have an additional publication from Cedars when I applied for residency. So I think, and I just kept looking forward. What can I do for the next step? And I think that's what I've done by and large, probably through residency and even fellowship, is what can I do in that point in my career or career development that will help me for the next step? So, when I started residency here, I knew that I wanted to either go to Dana-Farber, Sloan Kettering, or Johns Hopkins. So then I did, what can I do in the next 3 to 4 years to get me to that point? When I did fellowship, okay, I want to go and I want to be faculty at the best possible place, and I want them to recruit me. What can I do? X, Y, and Z. And then I did that. So that's been my approach, and that it's been successful. These are very good
I have a question.
Sure.
So what would be like your recommendation for, like, if we wanted to do something clinical in university, like such as like working in some kind of doctor's office, like medical assistant, EMT, like scribing? Out of those like jobs or positions, like what do you think would be the best way to get that clinical experience, but also like be able to balance it with school research and all that?
So that's a very good question. I think ideally, this is not easy. You wanna be able to go to more of an academic center to do your shadowing, whether at UCLA, Cedars-Sinai, UC San Diego, somewhere that has some academic of USC, because it's the medicine is also practiced a little bit different. So I think that carries weight, and plus you get to interact with people that have some affiliation with the School of Medicine. And trust me, every connection matters. Vagan brought up a good point about luck. Sometimes a person you meet may know someone, or may review your application, or may be involved in something, or open a door for you. That's where the luck comes in, and you increase your chances to do that. I think if you can't get that, any type of meaningful longitudinal shadowing carries more weight, not short spurts. So you want to show that you've done something for an extended period of time. I'll give you a good example of this. Actually, I see one of my former students is on the line. She's Angela. So we'll ask her thoughts. So she's been very successful, actually. I still text with her and she keeps me abreast of everything going on. So I'll tell you some interesting things about Angela. So Angela, and I'm sure it's okay to share some of this, Angela, but Angela, she was one of the students at UCLA who came and worked with me. And Angela will attest, I pushed her and we did a lot of good projects together. Angela not only published, Angela ended up presenting her research at UCLA as an undergrad, which is quite impressive, as an oral presentation. She has already had acceptances from multiple schools. And she's an example of someone who found where her weaknesses and strengths were and then used unique experiences and highlighted it in the application to show how strong of an applicant she is. And she showed that it wasn't just a short period of time, actually it's well over a year. It was a longitudinal experience, both on the research side, clinical exposure, that she showed this is a meaningful 1 year plus project I'm doing. And it ended up helping. But let's have her actually weigh in on it. Angela, maybe you can share your experience and your successes and how you did working here and then what you learned in that process.
Yeah, so I mean, starting off my first year at UCLA, I kind of had no idea what I was getting myself into, but I knew that in order to kind of apply, I needed to make sure that the GPA was there. So I just tried to focus on classes that first year, and I tried to get into volunteering. So I volunteered at Glendale Adventist for like a year, and then COVID hit. So during those 2 years, it was kind of hard to do a lot of clinical work, but I did what I could. So I kind of went to like local like family practice offices. And from there, I tried to do, again, as much as I could. By the end of COVID, then I started looking into research. And that's when I initially joined it was a neurogastro lab at UCLA. And then from there, I realized it was kind of at a slower pace. I wanted something a little more. And so that's when I reached out to Dr. O. Actually, Dr. O and I connected over that. I started my internship at Cedars. I took the SRP credit 199 that UCLA offers. I did that for quite a bit. I think it was like a year and a half. But I think that research really pushed me to think critically. But again, it's important when you're applying to consider how certain things relate. Like Vahan was mentioning, it's critical that they have a message that so for me, my main message was being present at these, family practice, like it was an internal medicine clinic, being here and witnessing a patient, say, that had pancreatic cancer, to then going and working in a pancreatic cancer lab, that shows purpose for what you're doing. So I think it's important to convey purpose in everything that you do pick. That's what I think helped me formulate my story behind each of my activities. So yeah, you could realistically do anything. I personally scribed. I think EMT takes a lot of time. So you have to kind of prioritize what you're trying to do, research, EMT, etc. So I would kind of look into how much time you have.
Great, thank you for sharing that. Yeah, Angela's done very, very well. And again, I think, showing that you really do have a story is very important and that you commit to that story. And it's not just like, I did something for 2 weeks and this is my story. No, that it's like almost like an arc in a movie. It's like this kid, it spans over time, that you're really committed to it. It really, and it's true. It really reflects your path.
Yeah. And Dr. O is really good about, pushing all of his students to make sure that you're on top of everything. So I know, like you mentioned to me, to do shadowing at an academic institution. I know some institutions, they make it a little harder if you're not like working there. So I know UCLA, they don't allow undergraduate shadows, but if you're able to do like clinical research there, and then you're able to maybe that way you can include clinical research as working with patients as well. So it's a lot of, you just have to kind of figure out how you want to balance it out and write it out when the time comes. But I think having a vast variety of activities that kind of makes sense with your story is what's going to help you in the long run.
Excellent. So we have 5 more minutes left. We could take some more questions. The one thing that I want to tell you all is this is an excellent thing that you all have organized, that Hike has organized here. It's fantastic. And what I want to tell you all is everyone in this room, you guys are actually the best help for each other. The best help I ever had were my colleagues, my friends, the other folks I went to school with. When I was an undergrad, actually at UCSD, and they were Armenian. Both of them we were friends. We helped each other throughout this whole process. One is a radiation oncologist now, and the other one is internist at Adventist. And it's important that you guys help each other. You know, Vagan, I commend him. He's an MS1 and he's already volunteered to help. And you should take that help. You should all take that help wherever you can, and push and try to find people that will help you in this process. It's not easy. None of this is easy. And especially these days, medicine is not easy. And, you know, people say I go into medicine for money. If you want to make money, go to a different field. I'll be honest with you guys. Medicine, you go into medicine because you want to help people. You want a job that is intellectually stimulating. You want a job where you can teach, where you have true purpose, where ultimately, you know, when a doctor walks in a room, or people know of doctors, they have no faults. It's truly an absolutely noble profession. And if you can combine that with research and science, then there is no better job, in my opinion. And you guys the fact that you're here again on a Thursday says a lot. And if there's something I can personally do to help you guys, Ike has my contact. Feel free to reach out. Sometimes I'm busy. I don't get back to you immediately, but I will make time to get back to you and use the other resources here. So that's my last parting words. And if anyone has any questions, happy to help.
Thank you so much. That's it. That's
Yeah,
very
thank you so
helpful.
much.
Yeah, just coming from like an MD, it's happened before where I do try to reach out to any healthcare professional, not even an MD, and they don't really want to give their help. So to have somebody that's ready to help, and just you coming here and speaking today is just such a great thing that you did. So thank you.
It's my pleasure. It's my honor. And because if I do this, some of you in 10 to 15 years are going to do this for someone else. You have to, in medicine, there's a saying, pay it forward. You can't pay back. I can't pay my mentors. I can't do anything for them. But what I can do is I can pay it forward so that you guys can do this. You're empowered. You do great research. You do great clinical care. You become the best possible doctors, and you help the Armenian community and help each other. So my only ask is you guys excel and pay it forward. Okay? Great, everyone. Well, you have a good evening, and we'll all be in touch soon.
Thank you so much.
All right, take care.
you.
Thank you, Dr.
Thank
Osipov.
you for coming,
pleasure.
everyone.